Hello and welcome to our second annual Prenatal to 3 Research to Policy Summit. I'm Cynthia Osborne, and I have the privilege of directing the Prenatal to 3 Policy Impact Center here at the University of Texas's LBJ School of Public Affairs. And we are grateful that so many of you have joined us to learn more about how we can build a stronger and more equitable system of support for our infants and toddlers and their caregivers. This year has been especially trying, as you well know, and our caregivers and families need support more than ever. Thank you to the policy leaders who have pushed forward over the past year to adopt and fund policies and programs to support early childhood. Also, thank you to the state agency leaders and staff who have worked to implement policies and programs to create a stronger and more equitable impact on families and their children. And thank you to the advocates who have worked tirelessly to educate us on the needs of children and caregivers and to constantly urge us to do what is necessary. And thank you to the scholars who have pushed the boundaries of science on child development, as well as rigorous evaluations of policies and programs to guide us on what works. And a special thank you to the educators and nurses and doctors and home visitors and counselors and specialists and therapists and everyone else who's been working on the front line to support families and children. You have struggled to care for others when it's been very difficult to care for yourselves, so thank you. Thank you also to my team who has done an immense amount of work to bring the summit to you, including creating the second edition of our Prenatal to 3 State Policy Roadmap, which we are excited to share with you today. 2 years ago, we launched the Prenatal to 3 Policy Impact Center, and the guiding principles of our work have always been that it's grounded in the science of the developing child, that we're committed to promoting greater equity, and we're guided by the most rigorous evidence that's available. Our purpose is to be a resource for state leaders who aim to ensure that all children have the opportunity to be born healthy and to thrive. The science is clear that the most important thing that we can do as a society is to ensure that all of our children are born healthy and raised in safe and stable, stimulating and nurturing environments and have limited exposure to adversity. And our goal continues to be to identify the most effective investments that states can make to foster these environments for infants and toddlers. Although we wish we could all be together in person this year, we are excited that so many of you joined us from all over the country. Thousands of you registered for this event, and in every state, including DC, is represented, which really speaks to the level of commitment across our country to helping infants and toddlers and their caregivers. We have an exciting program to share with you over the next several hours, and we're going to begin by sharing with you evidence on why we need to invest in infants and toddlers. Too many children in this country do not have the opportunities that they deserve from birth, and disparities in opportunities and outcomes are pervasive and persistent. Disparities exist based on socioeconomic status and geography, but they also persist based on race and ethnicity. And our policies must not only be effective at improving outcomes, they must also reduce disparities to truly promote greater equity. We will then invite you to explore our revised and streamlined Prenatal to 3 State Policy Roadmap, which can be found at pn3policy.org/roadmap. And the roadmap is intended to provide solutions to reducing disparities in opportunities and outcomes, and to be a guide for states on how to build a stronger and more equitable system of support for infants and toddlers and their parents. We have an inspiring group of state policy leaders joining us today. Our first panel of speakers will share how their states have transformed their early childhood systems and made substantial investments in the health, safety, and education of children from birth. And I'll then provide greater details on the policies and strategies in the Prenatal to 3 State Policy Roadmap. And I'm excited to share the immense progress that so many states have made over this past year. This time last year, we all feared that states would be slashing budgets and cutting benefits and programs. However, instead of moving backward, most states moved forward. We'll also illustrate for you how state policy choices affect the resources that families have available to provide for their children. We've created an animated video that spotlights the variation in resources across states that we're excited to share with you. And in our second panel, we're fortunate to be joined by elected officials from 4 states who are going to share information on their state's successes in moving policies forward and investing in infants and toddlers and their parents this past year. And finally, we'll share our plans for moving forward. The policies and strategies that we include in the roadmap are the most effective based on the currently available data. However, we continue to monitor and build the evidence base to learn more about what works to support infants and toddlers. And as we identify more effective policies, we will add them to the roadmap. So again, welcome and thank you for joining us today. And we look forward to working with you on your journey to ensure that all children thrive from the start. I'd like to begin by sharing with you why we created a prenatal to 3 state policy roadmap to guide states on how they can invest to make sure all of our children thrive from the start. As most of you know, the prenatal to age 3 period is the most rapid and sensitive period of development, and it sets the stage for all subsequent health and well-being. During this period, infant and toddler brains are forming more than 1 million neural connections per second. And their brains are expecting input from their environment to understand what language they'll speak, what's safe, what's scary, who to trust, and other things. Children born healthy and cared for in nurturing environments are set on a trajectory toward lifelong success. But infants and toddlers who live in extreme poverty, who suffer abuse or neglect, or who are exposed to chronic stress during this important developmental period may be harmed neurologically, physiologically, and emotionally. And the damage may have lifelong consequences for their physical and mental health, their social relationships, educational achievement, and employment and earnings. And based on this science of the developing child, we identified 8 prenatal to 3 policy goals. These goals include making sure families have access to the effective services that they need, that families can balance work and caring for their children, and that work pays so that families have sufficient resources, including adequate food and housing, healthcare, transportation, childcare, and other essentials. These resources reduce the stressors that many families face and empower parents and limit children's exposure to chronic adversity. In addition, children need to be born healthy to healthy parents who have the physical and emotional health they need to care for their children. Parents also need support in enhancing their parenting skills and knowledge of child development so that they can provide the nurturing environments that lead to more optimal brain and body development. As they say, children do not come with an instruction manual, and we can all use help. When children are not with their parents, they need to be in nurturing childcare environments, which means we have to care for all the caregivers who care for our children. Finally, as early as possible, we need to identify any delays in development that children experience and connect children with the services they need to get them on track toward lifelong healthy development. Unfortunately, not all children live in environments that create these conditions, and many children are exposed to chronic poverty, stress, and trauma from birth. Too frequently, it's children from lower socioeconomic statuses and children of color who are the least likely to have the opportunities they deserve during the earliest stages of development and beyond. For each of the 8 goals, we identified a set of outcome measures or indicators that illustrate how infants and toddlers are doing across all states. Too frequently, the well-being of our littlest ones differs systematically based on where they live, the income of their parents, and their race or ethnicity. And these differences are often shaped by state policy choices. And I'm going to spotlight 3 areas to illustrate the well-being of families and how they vary by state and race and ethnicity. I'm going to look at health, financial security, and nurturing environments. So beginning with health, mother's access to health insurance is vital for her own health, particularly during the perinatal period, and for promoting the health of her children. But in the US, over 23% of lower income women of childbearing age lack access to health insurance. And this number is much higher in states that have not expanded Medicaid. For example, here in Texas, nearly half of low-income women between the ages of 19 and 44 lack health insurance, which is the highest uninsurance rate in the country. These women would be eligible for Medicaid if the state expanded the program, but currently no childless adults are eligible for Medicaid, and parents have to earn less than 17% of the federal poverty level to qualify. For a family of 3, this would be equivalent to earning less than $311 per month. By contrast, less than 4% of similar women in the District of Columbia lack health insurance. DC has not only expanded Medicaid, but it provides coverage to parents with incomes up to 221% of the federal poverty level, rather than the 138% that Medicaid expansion requires. And this vast disparity across states in health insurance coverage is a clear result of state policy choices. Uninsurance rates also vary considerably by race and ethnicity. In particular, Hispanic women are nearly twice as likely to be uninsured compared to other women. Another health indicator is access to quality prenatal care, which is linked to healthier birth outcomes and better health for the mother. However, nearly 15% of women in the US do not receive adequate prenatal care. And this ranges from a low of 5% of births in Rhode Island to nearly 25% in New Mexico. And the percentage of Black women who do not receive adequate prenatal care is 2 times higher than it is for white women. And this difference in access to adequate prenatal care is one of the drivers of the stark differences in birth outcomes between Black women and other women. For example, the proportion of Black babies born preterm is 50% higher than it is for other babies. And the rate of infant mortality among Black babies is twice the national average. Where a baby is born is also predictive of its birth outcomes. For example, babies born in Mississippi are nearly twice as likely to be born preterm and nearly 3 times as likely to die in the first year of life compared to babies born in New Hampshire. Again, these differences in opportunities and outcomes are largely the result of state policy choices. Disparities in economic security are also vast and highly correlated with state policy choices. The research is clear that experiencing poverty, especially in the earliest years, can have lifelong negative consequences on health, education, social outcomes, and so forth. And we find that children under age 3 in Mississippi are nearly 4 times as likely to live in poverty as similar children in New Hampshire. And Hispanic and Black children under age 3 are 2 and 3 times as likely to live in poverty, respectively, as compared to their white counterparts. A third example of the disparities that children experience from the earliest years is the percentage of infants and toddlers who lack the nurturing environments that science so clearly identifies as essential for healthy physical and emotional development. The data show that in the US, nearly 2/3 of children under age 3 are not read to daily, and more than 2 out of 5 infants and toddlers do not experience nurturing interactions, such as singing songs or telling nursery rhymes or playing peekaboo on a daily basis. And these numbers are nearly 50% higher for Black and Hispanic children as compared to their white peers. Parents who are stressed and financially strained may have more difficulty engaging in these behaviors with their little ones, and this can have serious consequences for children's healthy development. The most serious form of adversity that children can experience in this important developmental period is maltreatment. And in the US, approximately 16 infants and toddlers per 1,000 experience maltreatment each year. The rate for Black children is nearly twice as high as it is for other children, which could be partially explained by the serious stressors so many Black families face, or the documented higher rates of surveillance and removal of Black children in the child welfare system. The rate of maltreatment also varies considerably across states, from a low of 2.1 per 1,000 children under the age of 3 in Pennsylvania to 39.5 per 1,000 in West Virginia. It's very likely that these differences are driven largely by differences in the state's child welfare systems rather than only differences in exposure to child maltreatment, however. So these 3 examples, they illustrate the substantial variation in opportunities and outcomes for infants and toddlers beginning at birth, The systemic racial and ethnic disparities and the disparities across states are largely the result of state policy choices, and they demonstrate the need for states to adopt and fully implement policies and strategies that will lead to enhanced and more equitable opportunities and outcomes in these earliest years.
My name is Kaylee Benson. I'm the Assistant Director at the Child and Family Research Partnership and the Prenatal to 3 Policy Impact Center, and I am thrilled to be here to introduce our 2021 State Policy Roadmap and a little bit about why the roadmap is an essential tool. The Science of the Developing Child provides a clear picture of the conditions that infants and toddlers need to thrive. And unfortunately, we know that infants and toddlers' environments vary considerably based on where they live and other characteristics such as race and ethnicity, and that many of our youngest children lack the opportunities they deserve. In response to this clear scientific evidence and systematic disparities in opportunities and outcomes, we turn to the most rigorous evidence available to identify the most effective investments that states can make to empower parents and create the conditions that allow all children to thrive from the start. Based on comprehensive reviews of the most rigorous studies, we created the Prenatal to 3 State Policy Roadmap, which identifies 5 policies and 6 strategies that, when combined, create a stronger and more equitable system of support for infants and toddlers and their caregivers. The 5 policies reduce the stressors many families face by providing broad economic and family supports to ensure that families have access to health insurance and adequate nutrition, that parents can balance work and caring for their children, and that work pays to allow parents to provide sufficient resources for their children. The 6 effective strategies help to enhance the capacities of families by providing more targeted interventions that address specific needs. These include programs that conduct comprehensive screenings and connect families to the services they need, subsidies to allow families to access affordable, high-quality childcare, group prenatal care, parenting supports, early Head Start, and early intervention services to address identified developmental delays. Previously, state policy leaders lacked information as to what the best investments are that they can make to support infants and toddlers. The State Policy Roadmap fills this gap and provides a tool for state leaders to help them develop and implement the most effective solutions to ensure all children get off to a healthy start and thrive. In addition to providing detailed information on each of the 11 effective solutions, the roadmap also tracks states' progress toward adopting and fully implementing each of the policies and strategies. Currently, there's a patchwork of benefits and programs for families across the United States. Where a family lives determines the resources it has available to support the healthy development of its infants and toddlers. Although all states can do more, especially given the strains that the pandemic has put on families, many states are making substantial progress toward implementing effective policies to support children and families. We recognize that changes to state policy often take time, and so in addition to indicating whether a state has fully implemented a policy, the roadmap also documents the annual legislative and administrative activity that occurs in each state toward the adoption and implementation of the 11 effective solutions. The primary purpose of the roadmap is to provide guidance to states on how to build stronger systems of support that lead to enhanced and more equitable opportunities and outcomes for infants and toddlers. To this end, the roadmap also tracks 20 outcome measures that allow states to understand how children in their state are faring over time across race and ethnicity and relative to other states in the U.S. Children are our most precious and valuable resource, and they all deserve the opportunity to thrive from the start. Unfortunately, many children are struggling. State policy choices can empower parents and promote the lifelong well-being of infants and toddlers. We are so excited to share with you today the 2nd annual Prenatal to 3 State Policy Roadmap. We will provide more detail of the content of the roadmap later in this event, but for now, we invite you to explore the roadmap on our website at pn3policy.org/roadmap. The focus of this year's roadmap is on the progress states have made this past year to support infants and toddlers. We heard your feedback on the first roadmap, and we tried to incorporate as much of it as we could in this new streamlined version of the roadmap. This short video provides an overview of how to navigate the roadmap and the information that it provides. Enjoy.
The Prenatal to 3 State Policy Roadmap is a guide for state leaders to help them develop and implement the most effective policies and strategies that create a stronger and more equitable system of support for infants and toddlers and their parents. The science is clear. Children need to be raised in safe, stable, warm, nurturing environments, and state policy choices can help empower parents and promote these conditions. Based on comprehensive reviews of the most rigorous evidence available, the State Policy Roadmap identifies 5 effective policies and 6 effective strategies that help to create the conditions in which children thrive. In addition to providing guidance on what works, the roadmap monitors states' annual progress toward adopting and fully implementing these effective policies, and measures the well-being of infants and toddlers in each state. You can explore the U.S. Roadmap, which provides a summary of all states' progress and well-being, or explore any individual state, including the District of Columbia, by using the drop-down menu or clicking on the map. The U.S. Roadmap begins with a summary page. It shows the number of states that have fully implemented each of the effective policies, as well as the states that are leading the way in implementing the effective strategies. Scroll down to see how the 8 science-driven Prenatal to 3 policy goals align with the 5 effective roadmap policies and 6 effective strategies. Each column represents one of the 8 policy goals, and the shaded circles in each row indicate that the policy or strategy positively impacts that goal and enhances the well-being of infants, toddlers, and their parents. The framework also illustrates the outcome measures that are associated with each policy goal, which we are tracking over time. The summary page also provides a short definition of each of the effective policies and strategies, but detailed information for each of the 11 solutions is available in subsequent sections of the roadmap. In addition to providing information on what works, the State Policy Roadmap tracks states' progress toward adopting and implementing the effective policies. To date, 4 states have fully implemented all 5 of the roadmap policies, and another 15 states have implemented at least 3. Over time, the hope is that all states fully implement all 5 effective policies. The focus of this year's roadmap is on the progress states have made over the past year in implementing the effective policies and strategies. 5 states fully implemented at least one new policy this year: Florida, Massachusetts, Missouri, New Mexico, and Oklahoma. And Missouri implemented 2. In addition, the roadmap provides information on the legislative and administrative activity states engage in toward policy adoption. We know that policy change often takes time, and that progress is often made even if the policy is not fully implemented. Finally, the roadmap summary page shows how the opportunities and outcomes vary considerably for infants and toddlers across states. These measures help states to set priorities for where to begin to build a stronger and more equitable prenatal to 3 system of support. More detailed information is available for each effective policy and strategy, and you can select the one that interests you. Each policy profile begins with a snapshot of the policy goals that it impacts, the states that have fully implemented the policy, and a brief summary of the progress states have made toward adopting the policy in the past year. Each profile also explains in detail what the policy is and why it is important for supporting the healthy development of infants and toddlers. Additionally, the profile provides specific examples of the impact that the policy has on each of the policy goals. As stated earlier, the focus of the roadmap is on the progress states are making toward adopting and fully implementing each policy. In each policy profile, we illustrate the progress states have made between last year and this year, and provide a thorough discussion of the legislative and administrative activity states engaged in over the past year as they work to adopt the effective policies. We also recognize that changes to state policies don't always happen quickly. and that some states will consider policy changes for several years before adopting them, or other states will adopt a policy but take time to implement it. We provide a summary of where states stand regarding fully implementing each policy. Finally, in each policy profile, we provide a series of indicators to illustrate the variation across states in the generosity and reach of the policy. For each effective strategy, we provide similar information. We begin with a snapshot of the goals the strategy impacts. Because the research for strategies does not yet provide clear guidance on how states should implement the strategy, we list a small group of states that we consider to be national leaders in the strategy, rather than providing information on which states have fully implemented it, as we do for policies. For example, the evidence is clear that child care subsidies impact maternal employment and facilitate the use of childcare. However, to date, the evidence does not provide clear guidance on the precise level of reimbursement rate or copayment level states should set to allow parents access to affordable, high-quality care. Thus, subsidies are currently considered a strategy rather than a policy. Similar to the policies, each strategy profile provides detailed information on what the strategy is, why it supports the healthy development of infants and toddlers, and the impact that it has on each of the prenatal to 3 policy goals. The roadmap also provides detailed information on how each of the state leaders are implementing the strategy, and discusses the policy choices states can make to more effectively implement and fund the strategy, and ensure that more children who are eligible for the services receive them. Again, the focus of this year's roadmap is on the progress that states have made this past year toward implementing effective solutions to strengthen the prenatal to 3 system of care. Therefore, each strategy profile shares detailed information on state progress. Finally, similar to the policy profiles, each strategy profile illustrates how the generosity and reach of the strategy varies across states. We invite you to explore over 100 indicators throughout the 11 profiles. You can also find detailed information on each of the outcome measures that are included in the roadmap. In the U.S. roadmap, the outcome measures are shown by race and ethnic group, and where possible, over a 5-year period, to allow for comparisons between groups and over time. The goal is to create a stronger and more equitable system of support for infants and toddlers, so we should see reductions in race and ethnic disparities in these measures as more states implement the roadmap policies and strategies. The final section of the roadmap provides information on the demographic characteristics of infants and toddlers and their parents. Where possible, the information is disaggregated by race and ethnicity. For detailed information on all of the data used in the roadmap and our sources, visit the Methods and Sources page. All of this information is provided in each of the state-specific roadmaps. However, the state roadmaps provide even more in-depth information on a particular state. The state summary page provides a snapshot of the policies that state has fully implemented, and indicates with a star the strategies on which the state is considered a leader. More detailed information on the legislative and regulatory actions the state took toward implementing each of the 5 policies and 6 strategies is also available in the state summary. And the state's outcome indicators are highlighted and ranked so that each state can measure how the well-being of infants and toddlers in the state compares to others across the country. The policy profiles also provide state-specific information, particularly on the state's progress toward adopting and fully implementing the policy. Similarly, for each strategy, the profile highlights the state's progress toward implementing the strategy effectively. The state's outcomes and demographic characteristics pages illustrate how the state compares to the U.S. The Prenatal to 3 State Policy Roadmap builds on the science of the developing child and identifies the 11 most effective investments that states can make to empower parents and foster the conditions in which children thrive from the start. This guide for state leaders also illustrates the progress that states are making toward implementing the effective solutions, and it allows state leaders to monitor the well-being of infants and toddlers over time.
We are truly excited to share the new roadmap with you, and we welcome you to explore it. We hope that it's a useful resource for your state, and please know that my team and I are available to answer any questions you have, and we look forward to ongoing discussions. I also invite you to visit our Learn More page on the roadmap, which may help answer some questions that many folks often have, such as, what is the difference between a policy and a strategy? And how did you choose which policies and strategies to include in the roadmap? And why didn't my state get credit for what we're doing? And we've heard a lot of them, and we tried to answer them for you. But before we transition to our first panel, I want to take just 1 minute to give a special thank you to Dr. Benson for the amazing leadership she showed in wrangling our team to produce this roadmap. Every one of our team members stepped in big time, but with 11 policies and strategies, 20 outcome measures, over 100 policy indicators for 51 states, there was a lot of moving parts. And she kept us all organized and focused, and she has the spreadsheets to prove it. They are seriously impressive. So thank you, Kaylee.